Do you have a tanning problem? Or are you told you're too tan? Or told by a dermatologist or doctor to lay off the tanning beds? Then you've come to the right place. Hi, my name's Andrea, and today me and my group members are going to be talking about reactive solutions to tanning addictions. Now, to begin, I want to talk about social media and text message awareness for tanning addiction. I'm sure most of you have Twitter, Snapchat, or Facebook, right? Well, these are just a few platforms that can get pertinent information about the terrible things that tanning can do to us. So I just want to give a few examples of what we had in mind as ways to get these out to those who may need help or figuring out if something is cancerous or not. The first is this picture here in the center, and it's types of skin cancers and precancers. Now, with this photo popping up in ads, it kind of encourages us to take a better look at our skin and do skin checks on our own, and that may help us to figure out if we need to reach out to a dermatologist or doctor for further testing. Next, up here, I have a video linked where it's actually the effects that UV does to your skin. So this is the same girl, but they turn on the UV lights and you can see the damage that the sun and the artificial bulbs have done. And that popping up on Facebook as videos or on any other social media platform, I think would be very helpful to see the damaging effects because those are everlasting and you can't fix those. Next, I have this text message group that you can sign up for, and over the course of a few months or once a week, whichever you choose to sign up for, you will be sent UV protection and skin cancer preventions. So here I just did an example of like tanning beds and what happens to them. And then just a little statistics such as, did you know that when you tan before the age of 25, your risk for melanoma increases by 75%? And lastly is an actual ad that could go on Facebook or Twitter. And this is a young girl who was 20 years old and actually diagnosed with skin cancer. And this photo on the right is a video or a picture of her after some of her treatments for the skin cancer that was on her face. And we have this little learn more link down here, which Brissa will talk more about, but it will take you to our virtual site where those who may have a tanning addiction or think they need to talk to someone about it can reach out.
Hi, my name is Bressa, and I'm going to be talking about the meeting portion of our solution to addiction. So, as Angie has mentioned, we're going to use the social media platform to reach a large population. And in our ad, there's going to be that Learn More button where they'll be taken to a website where they can access the resources to learn about what tanning addiction is and the resources for our meeting and other support groups that they can receive. So we want to do meetings similar to the setup of Alcoholics Anonymous meetings. We decided this because we've heard good things and they were beneficial to people we knew and to the guest speakers that we had come talk to us in class. So for the purpose of this presentation, I'm going to look at the statistics solely for Alcoholics Anonymous. So to start off with, Dan Wagner from the American Addiction Centers wrote an article detailing the success rate of Alcoholics Anonymous. And one reason this is hard to calculate is because the possibility for a breach of anonymity of the members, because Alcoholics Anonymous is supposed to be anonymous, and a research study does break that confidentiality a bit. But he was able to calculate the success rate to be about 8 to 12%. In 2014, AA itself conducted a study of more than 6,000 members and calculated that about 22% of members were sober for 20 plus years. And finally, according to Leanne Cutsticks in Alcoholics Anonymous, higher attendance rate to meetings is directly correlated to higher rates of abstinence. We would like to do these meetings over Zoom to begin with because we don't know the population of tanning addicts, and we don't know if there's a large enough population to be in-person meetings in one place. And we want the meetings to kind of be based on the Book of Joy, the acceptance chapter, where we want them to be able to identify that they can't succeed by denying what exists, and we want to get them to achieve the mindset that acceptance was the final pillar of the mind.
Hi, so I'm Abby Mori, and I'm going to be talking about how treating underlying psychiatric disorders may ultimately help treat a tanning addiction. So, as we know, addiction itself is a mental illness. However, there are a couple specific mental health disorders that are risk factors for developing a tanning addiction. Those include body dysmorphia syndrome and obsessive compulsive disorder. So, I'm going to talk about what each of those are, and then I'll talk about the treatment for those. So, body dysmorphia disorder is characterized by the inability to stop thinking about a perceived defect or flaw um, in appearance, independent of how minor it may be or how somebody else might not even be able to see it. These perceived flaws lead to significant distress and embarrassment, shame, and anxiety, which may lead to avoidance of social interaction. Repetitive behaviors such as tanning become a ritual of sorts that help achieve temporary satisfaction with their self image and help decrease their levels of distress. However, this is only a temporary solution for them, and that anxiety always returns, to which they have to keep engaging in those behaviors to relieve that distress again. OCD or obsessive compulsive disorder is characterized by uncontrollable, reoccurring obsessions and compulsions that a person feels the urge to repeat over and over again. The obsessions are repetitive thoughts, urges, or mental images that cause anxiety, and the compulsions are repetitive behaviors that a person feels the urge to do in response to that obsession or that thought that keeps on bothering them, um, in order to relieve that anxiety. In a person with a tanning addiction, these obsessive thoughts usually revolve around body image or body appearance and the ways to improve it, while the behaviors or compulsions take place in the form of the tanning itself. So the treatment options for both OCD and body dysmorphia disorder are very similar and both revolve around cognitive behavioral therapy and a medication such as a serotonin reuptake inhibitor, which is often given to treat depression. Because these treatments are so similar and cohesive, it leads to a more straightforward approach towards treatment for the disorders and ultimately for tanning addiction itself, as if we treat the underlying disorders that lead to this addiction, we can often treat the addiction itself and help solve that. Um, so, yeah, we know that there's no single solution for addiction. So we've each chosen a little component of it that all work together to bring awareness to the situation and to help treat it in different ways. And then here are our references. Thank you.